Now to the major change by the FDA when it comes to hormone replacement therapy. The agency is now removing the warning label from 6 menopausal hormone replacement therapy products used to treat hot flashes and other symptoms. The updates include removing risk statements related to cardiovascular disease, breast cancer, and dementia. Health Secretary Robert F. Kennedy Jr. says by removing these box warnings, we ensure that women receive accurate information about hormone therapy free from exaggeration or fear. Joining us now is the FDA Commissioner, Dr. Marty Makary. Commissioner, great to see you. Why did you take this big step?
Well, we want women to have good information about what they can do for perimenopausal symptoms, and also to know about the profound long-term health benefits of starting hormone replacement therapy within 10 years of the onset of menopause. And that's an important distinction. This is a nuanced topic, and it turns out that when you take it as recommended for those women who are candidates, which is the vast majority of women, that it has a powerful effect in reducing heart disease. The old warnings warn that you are going to have a higher risk of having a heart attack. There's also profound benefits in reducing cognitive decline and improving bone strength, which is important, especially later in life. So we wanted women to have the truth, and so we have updated the label now so it does not represent the old dogma, but instead good evidence.
So, Commissioner, we've talked about this in the past. The step to remove these warnings has been universally praised by most of the doctors that I've at least spoken to across women's health disciplines. But even if the claims of associated risks have been exaggerated over the years, is there any concern that women won't have all the information they need when these warnings are officially removed from these products?
Yeah, good question. That's why all of the information is going to be on the package label. It's going to be based on good science, good studies. And, you know, that nuance that you're referring to is important because if the hormone replacement therapy is started after 10 years from the onset of perimenopause, then you do see an increase in cardiovascular events. So that's why this is a nuanced topic. We don't want a fear machine to scare women away. For the last 23 years, 50 million women have been denied or never offered hormone replacement therapy. Some asked for it and were talked out of it because of those overblown fears that was really based on dogma and a flawed understanding of a study back in 2002. So we're telling women the truth, and we're updating the labels so that women have all the information they need.
And that's a really important distinction, that when you take this medication matters. There's some new reporting I want to get your thoughts on. 2 top aides to Secretary Kennedy are leaving HHS. According to CNN, 3 people familiar with the move say Deputy Secretary Jim O'Neill and General Counsel Mike Stewart are expected to soon leave as part of a broader restructuring effort for this agency ahead of the midterms. I just want to get your reaction to those departures.
So I believe they're taking other roles in the government, although I'm not a part of those discussions. We're at the FDA, and we're a separate agency, but we work as a team. We work well as a team, and really that's all I've got for you, Ariel.
And that's okay. I want to ask you about another headline that's been emerging this week. The FDA this week chose not to review Moderna's application for a new flu vaccine that uses mRNA technology. That's been the center of a lot of scrutiny. Was this decision based on deficiencies in the data that you're reviewing, or is it a policy shift regarding mRNA platforms altogether, or is it just broader safety concerns? Can you just please help us understand this decision?
Sure. Well, first of all, Moderna has an mRNA flu shot, and they submitted some of that data to the FDA. And the FDA basically gave them a go back and revise because it was well recognized among the scientists at the FDA that the trial did not follow FDA guidance. As a matter of fact, some doctors have had concerns about the ethics of the study design, whereby people over age 65 got an old version of the flu shot that is no longer recommended for people over 65. And that was in the control group. And when the control group is not as powerful as standard of care, it can make the intervention group look artificially inflated, relatively speaking. So many people believed that the control group should have gotten the high-dose flu shot that's designed for seniors. They don't have the same immune response. And so that's why the CDC has recommended 3 flu shots for seniors over 65. Those three shots were recommended by the FDA for that company to use in the control group. They chose not to. And so this is a part of the dialogue that the FDA has with companies, whereby they can still have a path to approval, but they, for example, may be asked to go back and cut their data by age group and resubmit it in that way.
How does this square with your desire, as we've spoken about in the past, to see a universal flu shot sometime within this administration?
Yeah, that's really exciting technology, Ariel. So there are studies now, preclinical studies and early phase 1 studies that are showing that there are flu shots using traditional platforms that give broader coverage for the domain of the surface of the influenza virus. That means that you could have protection against strains that have not yet appeared in nature, strains that have not yet mutated. And you may need one shot and be good for decades in the future. We'll have to see what the data show, but they're designed to be a universal one-time flu shot with broader protection. We are very interested in those products, and if we get them, if the data does pan out, it could replace the annual flu routine that we do as a medical community.
So one last question on this topic. Last month, Moderna's CEO said that the company is not going to plan to invest in new late-stage vaccine trials because of growing opposition to vaccines from U.S. officials. So if companies like Moderna are making changes like this, they're not investing, could that put us behind in the development of vaccines and ensuring public health and safety?
Well, first of all, that statement by that company predated any decision from the FDA to take another look at the application that they submitted. And as a matter of fact, on the earnings call, Moderna said today that it is their global business where they are seeing their higher bulk of their business. So it's up to them to run their business. When it comes to the FDA, there is a path to approval for the new mRNA flu shots, but we are using basic evidence-based principles, and when the FDA gives guidance on how to design a control group, usually the scientists like to see that guidance followed.
So let's talk for a second, Doctor, if we can, about the surge in measles cases in South Carolina. Cases as we know it, they're getting updated today, are nearing 1,000 in mostly Spartanburg County, that's in upstate South Carolina, since the start of this outbreak. And South Carolina is just one of at least 24 states now reporting cases so far this year. The majority of infections, as we've talked about, are in unvaccinated people. Doctor, should all Americans who are eligible get the MMR vaccine?
Well, look, I do believe the MMR vaccine is one of the core essential vaccines. And when we hear about cases of measles in an outbreak in South Carolina, that should serve as a good reminder for parents to make sure that their kids are vaccinated. And so it's an important issue. I've said it many times, and I'm happy to say it again. The best way to prevent measles is through vaccination.
So unequivocally, American people who are eligible should get vaccinated for measles.
You know, my personal view is yes, we are a regulator at the FDA, so we are not giving definitive medical guidance or serving as your doctor. But I do believe in measles on the core essential vaccine schedule, and I think everyone in this administration has been pretty clear that the best way to prevent measles is to get your kid vaccinated against measles.
Echoing what Dr. Oz just said as well. Dr. Marty Makary, thank you so much, as always, for your time. Appreciate it.
Thank you.